Since receiving his medical license in the early 1980s, Dr. Ramon Tayach was committed to improving the health system in his native Dominican Republic. Later in the decade, though, he was granted the opportunity to effect change abroad as well. Cardinal John O'Connor, then serving as Archbishop of New York, invited Tayach to the city, where he believed the doctor could make an impact among his low-income constituents. His leadership has since benefited a number of organizations, the most recent of which, Advocate Community Providers, aims to streamline Medicaid care.
This is what we've been doing all my whole life, and I believe is one of the things that we could help to maintain the good service for our poor communities.
ACP prides itself on bridging the gap between the system and efficient treatment. The network's more than 1,000 affiliated physicians administer services to nearly 1 million people in New York City, many of whom are immigrants. With doctors like Tayach, who were immigrants themselves, the organization can relate to patients' challenges and speak their languages. Dr. Tayach says this close relationship between giver and receiver makes people less likely to reserve medical visits strictly for emergencies.
Now we don't see the patient only about the treatment when it's in front of you. We have to know about the patient, I would call it 360, if whenever situations happen in their lives.
While some ACP physicians' care has gone as far as finding housing or reliable transportation for patients, the network primarily strives to improve communication between providers to avoid duplicate procedures and identify best practices. ACP assures the advanced collaboration will not only benefit patients, but also Medicaid as a whole.
All the prevention medicine, which is so important, all the quality measure now, a close prevention, and you work close with the patient, having them in good health, is the best way to save money to the system.
More than 1/3 of New York City's population is foreign-born. Many of these immigrants are low-income and thus receive public-funded health care from people like Dr. Tayach. With an upcoming name change to Somos Your Healthcare, or We Are Your Healthcare, ACP seeks to demonstrate once again a commitment to the poor of its community.
The opportunity to share